So there's a certain percentage in the population that has a really hard time of getting adequate vitamin D3 levels. And I think vitamin D is extremely important. It's highly underrated, and most people are deficient. It's over 90% in my experience in my clinic that people don't have enough of this. It's an extremely important vitamin hormone that regulates a lot of things in your body. And for optimal health, I think it's absolutely essential. But what happens is a lot of times when we take it in orally, it needs to be absorbed through the digestive tract. And there are a lot of cofactors and absorption issues with it. And if you have any issues like irritable bowel syndrome, or you have something more severe like Crohn's disease or celiac disease, you might have real issues getting enough in. And even if you supplement at very high amounts, not much comes in. So I think if you have any GI issues, absolutely get tested. Take the amount that you feel is right for you. That might be 5,000 or 10,000 international units. Talk to your doctor. But then after a couple of months, test if you actually have decent levels of vitamin D, right? In my opinion, that's at least, around 50 to 80. Now, if you don't have those levels, so there's a possibility that your GI tract just doesn't let you absorb enough. And in that case, and again, most physicians recommend against this, but getting in the wintertime in the Northern Hemisphere, a bit of UVB exposure. And then you can get that actually from a tanning bed. Yes, that there might be some risks associated with higher increased risk of cancer. That is true. But we're not talking about burning here. We're talking about using maybe half the time and only once a week or once every 2 weeks, not to burn at all, but to get some UVB radiation, because that does stimulate vitamin D production in your skin. And a lot of times then those patients that cannot get in sufficient amounts through the GI tract, through supplements or nutrition, suddenly have good levels because they can get it in now through skin production. So that's just an option. Discuss all these things with your doctor and dermatologist, but that's just one of the ways that we can optimize those levels even in the wintertime in the Northern Hemisphere.